In a clinical environment, dental students and dentists are continuously exposed to stress. Many researchers link different levels of stress with depression and anxiety. Studies show that the level of stress varies according to the career stage. This mental state is a result of many external physical or psychological factors, but a very important one is the working environment. The most common stressors are represented by difficult employers or colleagues, patients who are more difficult to communicate with, overburdening workload and working hours, and the pressure of meeting clinical requirements they must master. Chronic stress leads to burnout syndrome. Burnout impairs both personal and social functioning and often results in reduced work quality or even decision-making errors and damage to psychological and possibly physical health.
I knew that I was like in a war zone, though it's not a physical battle, but this is like health, based on health. So whenever I'm seeing patients, I prepare my mind, do my best. And at the same time, I tell myself, if perhaps we all know the symptoms, if I feel I've come in contact with any patient who has manifested the symptoms and probably has the virus, then I prepare myself as well and check, okay, am I having similar symptoms as I'm working? And if there's none, I just keep going ahead because our duty is to save lives. So as much as I try to be mentally stable, I must still give my best to my patient, regardless of whatever is going on. So mentally, I think I was able to adjust and deal with it that this is a new strain of the virus that has come up. We've had previous ones and people have survived. So I should also be able to survive.
And I was like every day going to the hospital with the stress that maybe I'll be exposed to COVID. It was like a lot.
A lot of students that I know did internships online, even if they were in the clinical area, which for me was really not something I wanted to do because I really did want to get some experience because it is the only time that we have practical input, let's say, in our university. Struggling to find a time slot that would actually work for both of my mentors. And this was because of the COVID measures were changing all of the time. So 1 month it would be okay to accept interns, 1 month it wouldn't be. And this was the same for us as psychologists, but also for medical students. So this was quite a struggle because it actually extended my whole year of studying because these were internships that I actually have to do to be able to finish my program.
The clinical placement every day because it's a new birth, it's like you just started again because you don't know how the nurse works. It's like, oh, my first day. And the next day you go again and you nurse, oh, my first day.
You don't know what you're doing there. It's a mandatory internship. They just tell the doctor, okay, you're receiving a student, and the doctor says, okay, and that's it. And you never know. You don't know why you're there. You're there, you're observing things, you're just taking in all your emotions, and no one's asking you, okay, so is this service adapted to you?
Stress because at the beginning, I don't know how they work, and I was very lost. And this get me a lot of stress and anxious because I go every day and thought, okay, I don't know what things I have to do, and I don't know the nurse. You are afraid, and it's more difficult to do things by myself. Like a student, maybe you can feel more invisible and less important. I think it's common in my case, and a lot of my friends feel the same. You don't feel comfortable. You feel like nobody cares you, and like you are invisible, and in the other one you are okay, you feel good, you gain confidence, and your practice are totally different, and you learn more, learn a lot of things.
Confused. At the same time, they ask me to how should I act or how should I behave or how should I help, help them. Like during the situation, they ask me a lot of questions because of my major psychology, and I try to help them. But at the same time, they restrict my actions because they didn't listen. At the end of the day, they didn't listen to me, and it was confused because it makes me confused because I don't understand. So what should I do now? And whenever I try to talk with that to the counseling psychologist, and this person has told me basically that, just take it easy and don't care about it. But I'm not that type of person. I want to care. I want to show that my, the interest, because I knew my position. I am the intern.
Because it was just too much for me. And this kind of environment isn't an environment that we're used to. It can really be frustrating and just sad. Just like it can impact our mental health a lot.
Because every single time I've felt anxiety on my shift has been because a lot of pressure and a lot of responsibility was put on my shoulders, even though I'm a student and I'm still learning, I'm still practicing. I don't know all the procedures, I don't know all the protocols, and maybe the nurse who's in charge of me just has a lot of work to do, cannot care about me as much. So she just leaves me and tells me, no, just take some constants or go check this patient or go. And most of the times it's a lot of pressure put into your. The main symptom of anxiety I'm feeling would be depersonalization, which for me manifests by not really being conscious of who you are or what you're doing. Like, whenever this situation is constantly repeated, and I have to take a lot of responsibility, which I shouldn't at this time, it starts to feel sort of automatic, and I feel out of myself. Like I'm okay, so I'm doing all the work I'm in charge of, and I'm being able to well, progress with the shift. However, it's not like I don't feel accomplishment, and I don't feel proud of myself. I feel the total opposite. I feel disconnected from my job, disconnected from my feeling of loving nursing in its like in its in all the context and all that matters. And it's something that really well makes me have this really sad feelings. It makes me, yeah, it definitely makes me feel really upset, which is getting to the point where I kind of doubt if care is something I want to work for. Like care, not as in hospital care, just care in general. If I can be a caring person, like
when you start doing practice, nobody tells you that you will find difficult situations. And when you find one, it's very shock. And in the last year, I found a patient that was in the final of her life. And yeah, I always, I go everywhere, every day with her, and give her the medicines, and this shocked me a lot because I think that I couldn't do nothing for her because I was only a student. So I feel very angry, anxious, I don't know.
Facing life and death situations in the clinical environment for medical students is extremely stressful. Even during phases of being an intern, medical students are expected to diagnose and be able to treat or start out an approach to deadly illnesses like heart attacks and strokes. This reflects on our studying efforts because we have to make sure we learn those patient approach algorithms so that lives are not lost during our medical interventions. This creates anxiety, and sometimes failing grades or exams can lead to depression for medical students because then we feel like we cannot be good doctors in the future.
And that's affect me a lot because when I arrive at my home, I think about it, and it's a common thought, and I feel sorry. Okay.
It's okay.
And I feel guilty because I didn't do nothing, and the situations can occur again, and I cannot do nothing because I'm a student, and it's always the same thought. You are all the time doing things and thinking like, I have to do this and the other thing, and you don't have free time, and I'm very stressed all the time. I feel anxious also because I think that I will not arrive to do all the things that I have to do. And if I do something wrong, I won't be a good nurse, and all the time like this. And there are not a lot of free time because if you are like 8 hours at practice and then you have to do a work when in my university, you have to do a work during the practice, and you have to connect to some classes. So you have to do practice and then do the work. And I think that you have free time only 1 hour to work out and no more.
On me, like I don't think the nurse who's in charge of me is guilty of those feelings. However, all these nurse to patient ratios and how the system is structured does kind of affect me in the long term.
Because I know there are some things that you can do to encourage health workers to keep doing their best, because we sacrifice a lot. We leave our families, we leave our loved ones. Many times we spend more time in the workplace than even with our family or our friends. Sometimes we don't even have enough time for relaxation. So
to have another student, because you can talk to him and share experience, and you don't feel alone in front of this practice.
I would say I don't think enough attention is being paid to physicians' mental health, because I've seen a lot of people, they die out of stress. So we all have the mindset that I want to save my patient. Patient comes first. And with that mindset, we tend to neglect our own physical well-being. Even as much as we are aware that the virus is here, we are living with the virus, but then sometimes the amount of people who come down with the virus or with sicknesses are actually more than what the doctors can handle at a particular time. So most times we are overworked, we are overstressed. Even as much as we try to do the shifting and the rotation, you still feel some people get some attachment with some particular patient, and you still want to give your best, you still want to do this. So in that way, we kind of neglect our mental health. Even though normally they will tell you, take care of yourself first and do this and do that. But somehow, not everybody does that. At the same time, some people get overwhelmed and find themselves coming down.
we had some courses before starting the internship about like how the hospital functions, what's the system there, and some hygiene, how do we say, like hygiene precautions to take. But we never had a course preparing us preparing us mentally for this internship. I was at the Cystic Fibrosis Center. Cystic fibrosis is a chronic disease and people are born with. Sometimes I was overwhelmed. It was a lot for me to see patients burst into tears during the visit, and no one ever asked me if I wanted to be there, if I was comfortable, or after if I was feeling well. So all I had to do was just control my emotions and take all these negative energy in, and like just trying to keep my head up high. And it wasn't easy at all, and I think it's necessary, it's more than necessary for us to have like a number at a therapy session, or just someone to contact if it's not suitable for us, if we're not feeling comfortable with this kind of situation. And I think that we should go to an internship and have an internship with a specific mission. We should know that, okay, in this internship in 5 months I have to learn this, that, I have to do this and that, and just missions that are suitable for us, not like, I don't know, because I was just observing and learning about the disease, which is amazing. I learned a lot, but at the same time I was feeling useless because I was there and just, I didn't do anything. I was just looking, taking all these emotions inside me, and just seeing patients burst into tears, seeing parents like that couldn't handle it anymore, and it was a lot. And it's frustrating that no one ever asked how you're doing.
Like from the university, we need a subject or something that teach us to cope with difficult situations and give us tools to solve them and manage the stress, I think.
The findings showcased by the testimonies and our organization surveys show a clear message. Healthcare students need help. For that matter, we call to action EU institutions, member states, ministries, but also healthcare professionals and faculties to
learn the consequences of the COVID-19 crisis regarding the students' mental health.
Create learning outcomes prior to the start of the internship to be clearly expressed to the students. This would help imposter syndrome and quality assurance of the internship.
Provide soft skill trainings on communication and emotional intelligence, and organize sessions prior to the internships in order to prepare the students for the work environment in the hospital.
Make sure mental health assistance is available.
Make available a national number for students to report and talk about sexual and gender-based violence anonymously.
As part of the European Health Parliament initiative, we believe that with 90% of doctors having reported some kind of depression, anxiety, or emotional stress caused or made worse by work, there must be a special focus on mental health at a hospital level. We believe that the focus must be on supporting and improving the mental health of healthcare workers through both systematic and individual interventions, aimed at the integration of mental health assessments of healthcare workers as a systematic tool in all health facilities and quality improvement programs to achieve cultural transformation, the implementation of independent healthcare workers support offices in healthcare institutions, the creation and implementation of interventions that can facilitate and promote a healthy lifestyle targeted at quality nutrition and physical activity, and the creation and improvement and also the sustainment of actions on mental health care and mentalization aimed at building and maintaining the resilience and well-being of healthcare workers.
Hi, I am Cyrus and I'm a member of the European Parliament from Malta, and I'm also the co-chair of the European Parliament's Mental Health Coalition. The way that we approach mental health in our societies is a bit wrong. This is because the way we approach mental health is through segregation. And I believe that this boils down to the fact that as a society, it is easier to stomach the idea that mental health is an anomaly, something that happens to someone else or just a few unlucky people. But in reality, it isn't. Mental health is something that we all will deal with at some point in our lives, either directly or through the people we love and care about. Our mental health is part of our holistic and overall health and well-being, and is triggered by various things. Thus today, it really is inevitable. And I think that it has always been inevitable because, unfortunately, as a society, we haven't had the courage to speak about the topic before now. But this is changing, and it is changing because of us, young people who are fed up with taboos. This is why, after reading the call for action from numerous European healthcare students' associations, I would like to join the students in calling for local, national, supranational and EU powers to adopt the recommendations being proposed and also move towards a European mental health strategy. We need to integrate care structures within our communities and create a culture of normalization when it comes to taking care of our overall mental health and well-being. And there is no better place to start than within our youth, especially those who are training to be the ones who look after us, who heal us, and who care for us during some of the most vulnerable times within our lives. Thank you for your commitment to this cause.